Welcome back, viewers. You are still tuned into Prime Live. We are honored to welcome the French medical charity Doctors Without Borders, or MSF. They now have raised a lot of alarm regarding the widespread of waterborne diseases like cholera in the aftermath of the worst flooding seen in Nigeria's northeastern Borno State. Now, the floods have displaced over 400,000 people and have since killed 20 others. But so far, there has been 2 confirmed cholera cases already and 40 suspected others. Now, what would this reality mean for a people already in malnutrition crisis, and what has been the response from Doctors Without Borders? Joining us this evening is Mathias, who is joining us and who is a project coordinator for MSF in the Borno State capital of Maiduguri, and he joins us live now over Zoom. Good evening, and thank you so much for joining us on Prime Live.
Good evening, and thank you very much for hosting me.
I hope I did a good job of pronouncing your name, but please do feel free to correct me at any point in time.
Thank you so much, but that's the least of the worries. There's no stress about that.
Now, thank you so much for joining us this evening. To get our conversation started, can you confirm that the government has been shutting down some of the emergency camps that were set up after the floods? And do you think people still need the assistance even though that the camps were shut down?
This is a very good question. It's good that you are sort of established a timeline. So the floods were a bit more than 2 weeks ago, on the night between the 9th and the 10th of September. Immediately, the government opened up camps. It went as high as 34 sites, if I'm not mistaken. And a lot of these sites that were used were primary schools. It happened to be a school holiday period, and therefore the infrastructure that was available lent itself very well to be able to host the people. The big issue is that while the infrastructure could cope with, let's say, the demand in terms of shelter, the sanitary infrastructure, the latrines, were certainly not able to do it. And this is the first thing that we saw was very, very alarming, let's say, sanitary conditions that set in within these camps. It was about 4 or 5 days later that the government came out and stated that because of the history of Borno State and the Islamic insurgency, it was unacceptable for the children to have to pay the price again. They already had missed 5 years of schooling in the past, and there was no discussion regarding not reopening the schools. Therefore, all the camps in the schools would have to be closed, which they did within 48 hours, and have kept some, let's say, other camps open that for people who no longer have access to housing or to relatives to be able to go and live in.
Now, we are looking at some really devastating visuals of some of the aftermath and effects of the devastating floods that have hit Nigeria. And there are already reports of collapsed septic systems, latrines and toilets in the affected areas, posing significant health risks, now particularly to the children and the elderly as well. Are you able to tell us more about the worry of possible disease outbreaks because of the circumstances and conditions that the people are faced with at the moment?
Well, you mentioned it very well at the beginning of the interview, is that this comes in the midst of the worst malnutrition crisis that we have seen in a while. And I see the worst is the highest number of admissions that the nutrition cluster here in Borno State has ever seen. What does it mean when people are malnourished? Is that they're immunodepressed. Their immune system is less resistant and are therefore more susceptible to diseases. Normally, this time of the year indeed is the rainy season, which brings with it, let's say, its fair share of mosquitoes, malaria. But this time around, because of the flooding, because of the contamination, as you mentioned, the latrines and so on and so forth, but the most importantly is the boreholes. A lot of people get their drinking water from boreholes. Boreholes that have been now submerged, contaminated, become a great source of possible contamination for cholera.
And now let's talk a little bit more about the suspicions around cholera, or rather the worry around the cholera cases that could potentially increase. I mean, we know now that there are already 40 suspected cholera cases and 2 have been confirmed cases actually have been reported. Can you confirm that cholera has become a reality in these areas already?
Yes, I mean, we have MSF, so we are MSF Belgium. There's MSF France with us as well here in Maiduguri. Together, we've opened about 50 cholera beds here in Maiduguri, and we certainly have patients. As I speak to you tonight, We have more than 45 patients in bed. Are these cases fully confirmed to be cholera? It's not lab confirmed, but clinically very, very strong clinical resemblance. So we treat them as such, and we hope that the treatment works.
I mean, we're looking at some really devastating visuals of the effects that this flood has had on people in the area. And it's absolutely heartbreaking to be able to see the effects that it has had and how many people it's actually displaced. But are you able to take us through some of MSF's responses in these affected areas? And what are some of the challenges that you're currently dealing with in terms of the areas that you are servicing as well as the people that you are assisting?
So, as you know, I mean, following a flood, the immediate flooding is you're dealing with the people that were injured, and this is quite, put it in perspective, a light patient load, probably more severe, but lighter. As now we are, 17, 18 days after the floods, you have all, let's say, the patient load linked to the ongoing pathogens that start revealing themselves. We originally are a malnutrition project. We cater for children from 0 to 5 years old. And during the floods and the aftermath, we had a big drop in our numbers. We went down to about 250 beds, 250 patients in bed on one day. As I speak to you tonight, we're at 353. Each day it's been gradually increasing. And we see kids that come in more and more severe, I would say, states. It's malnutrition linked with pneumonia. You've got malaria, you've got acute watery diarrhea. So this is where our main difficulty lies, is that we often have children that come in a very severe state. We call it late patient presentation, and it's a race against time to be able to save them.
I mean, the health risks are absolutely already there. And the floods came at a time where, like you mentioned earlier in the conversation, where northern Nigeria is battling a malnutrition crisis. How does the aftermath further the already complicated situation in these affected areas and the people that are already malnourished? How does it further affect the situation in these areas?
Well, about 2 weeks ago, I was having a conversation with one of the government officials, yeah, and we were both of us very much looking forward to the harvest because let's say the lean season is a historical event here in the region. We are very close to the Sahel. The climate is quite punishing. So the lean season is something that happens on a yearly basis. Unfortunately, it's been further aggravated by multiple factors. But this time around, we were really looking forward to this harvest, and this should alleviate a bit of the malnutrition, bring down the price of food, and allow food security to return for a lot of people. These floods have completely upended the table. Today, some agricultural land was flooded. The three main food markets of Maiduguri were washed away. We saw a massive inflation, a really acute inflation in terms of the price of food. So all these are problems that compound themselves. And while
Apologies, I think we have lost audio. Apologies for that, viewers. We will try to reconnect. I know a lot of you want to find out a bit more about what are the situations that people are currently in, particularly this area that is already really devastated by something like malnutrition. But we will try and get him back on the line. Good evening. Are you back with us?
yes, I think I can hear you. Sorry about that.
No, please do continue.
Sorry, it seems the internet is a bit capricious. So I was saying is that what we're looking at, the reality that we're looking at now is possibly another peak, a second peak of malnutrition for a longer period, and have to deal with all the different pathogens that have added themselves, all the pathogens that come with, let's say, unsanitary conditions of living. So what do we see at the moment? A lot of diphtheria, measles, malaria. All these are on the rise together with malnutrition.
Now, a question that we're getting a lot from our viewers at home is, what are some of the absolute necessities that people need right now? If you could list them, or just from your experience and from people on the ground, what are some of the items, what are some of the healthcare products, as well as, food items that are really, really in need at the moment for people in these areas?
Well, the necessity of items changes with time. Straight after the floods, it was a lot linked with, let's say, NFI, so non-food items, jerry cans, anything that enables people to gather clean drinking water. For the female population, sanitary kits. Sanitary kits are always something that is very much needed, and still to this day. I mean, the most important at the moment is food. Is that the staple crops that we have here is everything from corn, sorghum, rice, and this is what is needed, is clean drinking water and some food. We really are back down to the basic necessities.
Now, in terms of what is needed from, the public and the community, in terms of what is needed to be able to support the people in this area during this very difficult time, a lot of our viewers at home are wanting to know if there is any way that they can contribute to the efforts from MSF to be able to assist the people in the areas with some of the needs, perhaps through donations or anything like that. If you can please share any information on how our viewers can actually contribute to assisting the people.
Absolutely. So MSF, we receive cash donations. You can find all the information on our website, msf.org.za. The main thing that I can tell you is that MSF does not accept earmarked funds. So we do not accept funds that go particularly to a certain crisis. We can guarantee to you that, let's say, out of every rand that you give, 70 cents of that rand goes to the field. Only 30 is used for admin costs. But we cannot guarantee where it will go. It will be used for operations, but it's not necessarily for Maiduguri. We're present in 70 other countries as well. So unfortunately, Maiduguri is not the only crisis going on worldwide at the moment.
Absolutely. Thank you so much for joining us this evening and for painting the bleak picture of what it's like to live under the conditions of this disaster that has transpired, as well as alerting us to some of the issues and as well as health risks that people are facing. And to MSF, that we really commend you and thank you for your effort in always making an impact in the world and assisting wherever is necessary.
We but a teardrop in the ocean of what's needed. But thank you very much for your time, for spreading the awareness, and to any potential donors and to people listening. Thank you. Have a good night.
Thank you very much. Viewers at home, that was the coordinator from Médecins Sans Frontières, or better known as Doctors Without Borders. We are very familiar with the incredible work that they do in countries all around the world, whether it be plagued by illness or natural disasters. MSF has absolutely made their mark in terms of providing much needed healthcare as well as support for the people in these affected areas. Now, particularly in the areas of northern Nigeria where they have been affected by the floods, you have seen the visuals. Please do contribute to MSF's amazing initiatives. Even though you may not guarantee that the funds are going directly to the Nigerian people, MSF are placed in countries all over the world where help is absolutely needed. They are providing much needed healthcare as well as food to affected communities. So please do open your heart and contribute in any way you can through their website. You can absolutely go there to make a contribution to assist the efforts that they are making to make a difference. But if you can't donate, please do share their pages on your social media platforms in the hopes that somebody else might also be able to contribute. But viewers at home, on that note, it is time for us to take an ad break and we'll come right back.